Okay. Can you tell me how CellTrust fits into the big scheme of mobile health?
Yes. CellTrust really starts to bridge the gap that's missing in mobile health. And when I refer to mobile health, it's really the communications piece that CellTrust comes in and secures. We offer secure mobile technologies that encrypt both the SMS channel, the data channel, as well as voice channel options. But really here today, focusing on that encryption of messaging throughout healthcare.
And encryption is a must.
Encryption is a must. Really, the drivers obviously come very heavy from HIPAA, from FCC, from HITECH Act. So compliance is a big piece of it. But when it really comes down to it, when you dive deep and really examine the whole landscape and how things are looking, the evolution of technology is what's driven wireless to become such a big part of healthcare today.
And can you tell us what is the biggest challenge today, at least from your perspective, with privacy and security, particularly as it comes to healthcare?
Yeah, the big drivers in how we look at it from a CellTrust perspective is you need to really assess what your mobile strategy is. And in assessing your mobile strategy, there's certain topics that consistently come up. Am I compliant? Am I compliant to the rules of, like I mentioned, HITECH Act, HIPAA? Then it comes one step further to say, what's going on inside my organization? Are SMS messages going out between my doctors in a non-compliant fashion? And the answer is yes. And if you think otherwise, you're lying to yourself. You look at examining more mission-critical messaging, right? Is there any way that I could update my pager system and do things on that level? Bring your own device versus corporate liable. Where do I play in that? Device management. Is this something that's essential for my organization? And we've kind of taken all of those pieces, taken the right players in each one of these fields, and put together a solution that we feel can really get people ignited into healthcare. And it's called our Smart Pager solution. We've partnered strategically with both T-Mobile as well as Samsung, and have worked with Sodi as a mobile device management company to create this solution that allows for critical messaging in the healthcare environment. You can send, some of the big advantages, and what we've done is we've taken a snapshot of what paging looks like today in a hospital. We've taken the deficiencies, which include things like one-way communication messaging that is non-compliant. Very common in healthcare, you're going to hear this term page and pray.
Page and pray.
I've heard it so many times, but when it really comes down to it, if you're paging to a hospital and the pager is not in range, there's not really retry functions, there's no levels of redundancy because you're sending an SNPP connection out there, or a WCTP message, where CellTrust solution offers multiple redundant means of sending. There's a nursing portal or operator's portal that you can have some of your folks back at home at the office control that syncs with Active Directory. So there's one place where you can log in, everything's auditable, traceable, and you send your outbound messages. Again, redundant means of sending through both the mobile control channel, where T-Mobile provides an exclusive 4-digit short code that takes precedent over long code numbers or other short code numbers. So
that
really a very
difference,
direct line to page. Obviously improves efficiency, and overall, taking advantage of looking for a smarter pager that can provide smarter outcomes in healthcare.
Okay. Thank you very much.
I appreciate the time today.